Introduction. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, widely used to relieve pain, fever, and inflammation. It is available as an over-the-counter, OTC, medicine as well as in prescription strengths. 2. Drug class. NSAIDs, non-steroidal anti-inflammatory drugs. Analgesic, pain reliever. Antipyretic, fever reducer. Anti-inflammatory drug. 3. Mechanism of action. Ibuprofen works by inhibiting cyclooxygenase enzymes, COX-1 and COX-2. This leads to decreased prostaglandin synthesis, reduced pain sensation, lower fever, decreased inflammation. 4. Uses of ibuprofen. Ibuprofen is commonly used for mild to moderate pain, headache and migraine, toothache, muscle pain, back pain, menstrual pain, dysmenorrhea, fever, arthritis, osteoarthritis, rheumatoid arthritis, inflammatory conditions. 5. Dosage. Adults. 200 to 400 milligrams every 6 to 8 hours, OTC. Maximum OTC dose, 1,200 milligrams per day. Prescription maximum, 3,200 milligrams per day, divided doses. Children. 10 milligrams per kilogram per dose every 6 to 8 hours. Maximum, 40 milligrams per kilogram per day. Dose should be adjusted by a healthcare professional. 6. Routes of administration. Oral tablets/capsules. Syrup/suspension. Intravenous, hospital use. Topical gel, for local pain. 7. Side effects. Common side effects. Stomach pain. Nausea. Heartburn. Dizziness. Serious side effects. Gastric ulcer or bleeding. Kidney damage. High blood pressure. Cardiovascular risk, long-term use. Allergic reactions, rash, swelling, bronchospasm. 8. Contraindications. Ibuprofen should be avoided in peptic ulcer disease, severe kidney disease, severe heart failure, aspirin-sensitive asthma, third trimester of pregnancy. 9. Drug interactions. Anticoagulants, bleeding risk. Corticosteroids, GI ulcer risk. ACE inhibitors and diuretics, kidney function. Other NSAIDs or aspirin. 10. Use in pregnancy and lactation. Pregnancy, avoid especially in third trimester. Breastfeeding, generally considered safe in low doses. 11. Nursing and pharmacy considerations. Give with food to reduce gastric irritation. Monitor kidney function in long-term use. Avoid combining with other NSAIDs. Educate patients about overdose risk. 12. Common brand names. Brufen. Advil. Motrin. Nurofen.